Chapter 20, Fluid and Electrolyte Balance. So for body fluids, water is the most abundant compound in the body. On average, each person has about 40 liters of water in them. Water makes up about 80% of body weight in a newborn and then decreases as you age and is only about 60% in males and 50% in females. So here you can see just a picture of letting you know about where it is and where it goes. So about 25 liters are intracellular, which means inside the cells. 12 liters are interstitial, and then just a little bit, 3 liters make up your plasma. And then this is just to give you a visualization of how much of newborns, males, and females are composed of water. So the variation in your total body weight is related to a few things. One of them is the total body weight of the individual. Another is fat content. Fat in the body has less water content per kilogram, so adipose tissue is low in water. So the more fat you have, the less water you have. And then gender, because females have about 10% less water in their bodies than males do. And then age, because as we said, newborn infants have 80%, and then it decreases over time. And part of that is related to how much of the body is made up of what kind of tissue. So in the elderly, water per kilogram of weight decreases because your muscle tissue is very high in water, and in older adults their muscle tissue deteriorates. So now they have more adipose tissue and less muscle tissue. So adipose, fat, less water, muscle has more water. So body fluid in compartments. So if you remember, as the first picture showed the person with it separated out into the different compartments. So first there's extracellular fluid. This is the fluid that surrounds the cells and transports substances to and from them. So this is things like plasma. Remember, plasma was the liquid part of your blood. There's interstitial fluid. That's the fluid that surrounds each cell. And then there are some miscellaneous fluids. This is your lymph, your synovial fluid, your cerebral spinal fluid, or the fluid in your eye, just kind of random other miscellaneous places throughout the body. And then the other compartment would be intracellular. So this is the largest fluid compartment, and this is the fluid that's located inside your cells. And it's the largest because it serves as a solvent to facilitate intracellular chemical reactions. So sources of fluid. So for the most part, we get the bulk of our fluid through stuff that we drink, like drinking water, but we can also absorb some water from food that we eat, or water can be formed by breaking down the molecules in food that we eat and recomposed as H2O. So this is just an example. So where do we get it from? So we get it from drinking fluid or drinking liquids and eating foods. It's broken down in our stomachs and in our intestines to make H2O. But then we're going to lose fluid. We breathe it out in our lungs, we lose it in our skin when we sweat, and then we filter it out through our kidneys, and we excrete some in our large intestine with our feces. So what are the organs responsible for fluid output, since we were just talking about these? Lung, skin, kidney, and your large intestine. So your fluid output, which is mainly urine volume, does adjust based on your fluid intake. Other things that can affect it are, if you remember from our last chapter on the urinary system, are ADH and aldosterone. So antidiuretic hormone and aldosterone, and the reason why those are important is that they increase your kidney's reabsorption of sodium and water. So they tell your kidney to reabsorb fluid, which tends to increase your extracellular fluid, so that's the total amount of body fluid you have in you, and decrease your urine volume. So how much goes out decreases, but how much you now have outside of your cells in your body increases. Here's just a picture of a feedback loop. So let's say that I have a decreased amount of fluid volume circulating in my system. What that's going to do is drop my blood pressure. What's going to trigger my kidneys to initiate the different systems in my body that tell my kidneys to hold on to more fluid. So aldosterone is secreted, or antidiuretic hormone is secreted, and that tells my kidneys to reabsorb sodium. Well, where sodium goes, fluid goes. So now not only is it reabsorbing sodium, it's reabsorbing water as well. So now my urine output has decreased, but I'm holding on to more fluid, which is then put back into my extracellular fluid, so like in my blood or in my interstitial space, which then turns off this feedback loop because it says, okay, now I have enough again. So the regulation of fluid intake. So you have sensors that are going to detect a change in your volume and in the concentrations of fluid versus kind of molecules in your body, and they're going to send signals to your nervous system to tell your nervous system that I'm thirsty. You need to drink now because I don't have enough fluid. So and that's really just because your body wants to maintain homeostasis. It wants to have enough fluid all the time. So let's say I just went for a 3-mile run, super hot day, sweat a ton. When I get back, I'm going to have lost a fair amount of body fluid in sweat. So now my total volume of fluid in my body has decreased. So my saliva production decreases because I just don't have a lot of extra fluid around. But what that does is it causes my mouth to feel dry, which causes me to be thirsty, which then makes me drink water, which then restores that homeostasis, restores my body's balance of fluid. So edema, we talked about this a little bit last time. Edema is the swelling, and it's normally caused by a high interstitial fluid volume, or just a high fluid volume, high extrastitial fluid volume. Apparently forgot a letter there. And what it causes is that it causes fluid to leak out of your vasculature and go around and surround the cells outside of your blood vessels. So you should remember this from talking at the last chapter, which causes people to look like their extremities are swelling, but it's not that hot, swollen look that comes with an infection. It's very cool, and it's oftentimes referred to as pitting. And what pitting edema means, if I pushed my finger into it, it would kind of create this little dent that would be very slow to refill. So what are some causes of edema? Well, high fluid volume. So if I have a lot of extracellular fluid that's circulating around, so in my vasculature, if I have a low amount of things dissolved in it. So remember how, like for kidneys, we talked about not having enough protein circulating in your system and that causing the fluid to leak out, because remember it wants to be balanced in the fluid to molecule concentration. So if I have less in my vasculature, fluid's going to leave my vasculature to make it match what's outside of it. And then another thing that can happen is if you're not moving. Because if you're not moving, your muscle contractions kind of squeeze, almost like wringing a sponge. They squeeze the fluid back into your vasculature or into your lymph vessels so that they can be carried back through your body and put back into circulation. So if I'm not moving, I can get edema just because those muscles aren't squeezing the fluid back into my lymph vessels and my capillaries. So it's just sort of building up there. And that's a picture of pitting edema. So you can see where there are the finger imprints and they're just sort of hanging out there. It's pretty intense edema. So dehydration. Dehydration is when there's a smaller than normal amount of body fluids. So the fluid volume first shrinks, and then if treatment for this, so the interstitial fluid volume shrinks first, and the treatment for this, if your fluid isn't replaced, is that your body starts taking fluid from your plasma and from your intracellular fluid, so inside your cells, to compensate, to kind of fill up a little bit of that lost volume. And dehydration occurs when your fluid output exceeds your input for an extended period. So one way that we can test to see if somebody's dehydrated is you actually do this pinch skin test. So that's when you actually take a little bit of skin and you pinch it and pull it up, and it should, on someone who's well hydrated, spring right back. But if they're dehydrated and they don't have enough fluid in between their cells almost kind of like stick together. So if you pinch their skin up, it actually stays there, and it's very slow in returning back to normal because it's not like full and plump and mobile anymore. It just stays in that tent shape. So that's one of the tests we can do to see, very easy, common, unintrusive test to test somebody's fluid volume status. So the opposite of dehydration, you can actually have overhydration. So overhydration is when the total volume of body fluids is larger than normal. So the fluid intake exceeds the fluid output. And this excess volume actually kind of really burdens or strains the pumping action of the heart. And it can actually get to the point where it can cause heart damage because your heart is so strained from pumping around this extra fluid and working that much harder, because the more fluid you have, the more stretch in your vessel. Now the harder your heart still has to work to keep pumping blood forward, because there's already blood in that vasculature that it has to kind of pump against more pressure. So it can be very hard on your heart. And now the other thing that can happen is there's water intoxication. Now this is rare, though I actually think that there have been a couple of like water drinking contests where this has happened, that were in the news not that long ago, I guess, so probably a few years ago now. And this is a possibly life-threatening neurological impairment, where it's severe overhydration, where you basically just completely dilute your electrolytes, and it can actually be life-threatening because those electrolytes help maintain all those metabolic pathways in your body. And now you've basically impaired them by over-diluting them. So it's life-threatening. So related to intake and output is absorption and distribution of electrolytes in body fluids. And that's because we have to distribute them so that they can be available for the cells in your body to use them. So just a couple of very important ones are what we're going to touch on here. So there's sodium. Sodium's a very vital nutrient, though sodium should not be confused with salt. Salt, or table salt, is a combination of sodium and chloride. Sodium is different. So hypernatremia, remember hyper, too much, is what we refer to the blood sodium level being too high. And the measurement for that is too high is above 145 milliequivalents per liter. And this is normally characterized by a deficit of water. So you don't have enough water, which means that your salt concentration is high. Other causes can be if the person takes too much salt in their diet, or if they have prolonged diarrhea, which results in dehydration because they don't have enough water, they just have too much salt. And then on the opposite end of the spectrum, we can have hyponatremia. So hyponatremia is a low blood sodium, and that's below 136. And that normally happens when there's too much water and not enough sodium. So some causes for that would be if there's an excessive secretion of the antidiuretic hormone because you're excreting too much at that point. If there's a massive infusion of IV fluids that don't contain sodium, so something not normal saline, like let's say we give someone like a dextrose mix of fluid, so it doesn't have sodium in it, burns, and that's just because you lose a lot of it through that exposed skin, or some prolonged use of certain diuretics can drop your sodium level. So the symptoms of both hyper and hyponatremia are really related to central nervous system malfunction. And that's because most of your electrolytes have to do with your nervous system and making your nervous system function correctly. So some signs would be if you have headaches, they're normally confused, they can start having seizures, that's the pretty important one, seizures, and they can actually go into a coma. Potassium, this is another super important one. So hyperkalemia, potassium is called kalemia. So hyper, too much, that's when your blood potassium level is greater than 5.1. And the causes for this would be either an increased intake of high potassium foods, a shift. So that's if you have a trauma or burns, or actually having really low insulin and really high glucose, things like that can actually cause potassium to shift into your blood from other sources in your body. And renal failure, because then you're not excreting it. So some of the clinical signs that we see with hyperkalemia is normally related to muscle function. And the like neurological triggers for your muscles to function correctly. So this is normally weakness and paralysis. And then remember that your heart is made up of mainly muscle. So one of the biggest things that potassium affects is your heart muscle. So if you have either too high or too low potassium, it can actually cause you to go into cardiac arrest. So your potassium is really important for your your heart muscle to function correctly. So hypokalemia, hitting the other end of the spectrum, so that will be a low blood potassium, less than 3.8. And that's normally caused by things like fasting, a diet that's very low in potassium, certain laxatives or diuretics can cause your potassium level to drop, prolonged diarrhea or vomiting or gastric suctioning, and that's because you have a lot of potassium in those gastric juices. So the signs, cardiac problems once again tops the list because, like I said, your potassium is very linked to proper cardiac function. So now do you think I think that that's important? Smooth muscle weakness is another one. Normally there's abdominal distension, and that's because you really slow down the rate of your GI contents when you have hypokalemia. So calcium, hyper, so too much calcium, that's when your calcium levels are greater than 10.5, and that's normally caused by an excess input. You're taking in too much calcium, or for some reason you're absorbing too much calcium. Or another thing could be if something is causing your calcium level to shift from your bones out into circulation. Things like Paget's disease or bone tumors can cause that to happen, or hyperparathyroidism. They're going to cause a shift in calcium. And the signs for that, because remember, most of these electrolytes are related to your neurological function, so it shows itself as a neurological condition. So fatigue, muscle weakness, slow weak problems, and once again cardiac problems because calcium is related to muscle contractions. Hypocalcium, so not enough. This is when your calcium level is less than 8.4. And no, I don't really expect you to remember any of these numbers. I just want you to know high and low and a little bit about what it's going to do to your body. So a dietary deficiency is a big cause for this. You can also have a decreased absorption or an increased excretion, peritonitis or hypoparathyroidism, or skeletal problems like rickets or osteomalacia. And that's because your body's either putting too much calcium into your bones or it doesn't have what it needs to use the calcium. Or renal insufficiency, because that when you have renal insufficiency, your kidneys aren't doing a good job of excreting what they should and keeping what they should. So what are some clinical signs? Muscle cramping, twitching, hyperactive reflexes, and abnormal cardiac rhythms. That would be the end of this slide. Nice and short.